Hi, my name is MelissaStratton, and today I'm going to discuss congenital heart defects. I'm going to start with the etiology, which there's multiple factors. There's genetic factors, environmental factors, maternal conditions, nutritional deficiencies, mechanical factors, increased blood flow to the heart, dietary deficiency, substance abuse while pregnant and outside of pregnancy. There's all sorts of factors that come into play. When it comes to environmental factors, it talks about maternal infections and diabetes in the mother, maternal smoking or alcohol use during pregnancy, and exposure to teratogens, which would be like certain medications. There would be abnormalities maybe in the placental circulation or blood volume affecting heart development, possibly abnormal intrauterine positioning, or impaired blood flow during fetal development. These are all things that could contribute to this disorder. Let's discuss the demographics. Essentially, the incidence says that the most common congenital anomaly affecting approximately 1 in 100 live births accounts for about 25% of all congenital malformations. As far as gender goes, slight male predominance in many congenital heart defects, approximately 1.5 to 1 male to female ratio. Some defects like atrial septal defects show a higher prevalence in females. The age of diagnosis, they're most commonly in infancy diagnosed, but can also be detected prenatally via ultrasound. Some mild or less symptomatic defects may not be diagnosed until childhood or adulthood. Ethnic and racial differences, there's a higher prevalence in certain ethnic groups, such as Native Americans and Hispanic populations. And there's also some specific genetic syndromes that may vary in frequency across different ethnic groups. There's geographic variation, there's socioeconomic status, family history, preterm birth and low weight, maternal factors, again, that's coming into play. And like older maternal age, for instance, above 35 years old has been linked to an increase of some heart defects, which that's wild. The associated syndromes that kind of seem to coexist somehow with congenital heart defects is commonly seen in association with genetic syndromes like Down syndrome, DiGeorge syndrome, Noonan syndrome, and some structural abnormalities like a cleft lip, palate, and clubfoot. Now let's talk about the anatomy of congenital heart defects. Understanding the anatomy of the heart and associated circulatory pathways is key to diagnosing and managing congenital heart defects. These structural abnormalities often disrupt normal blood flow and oxygenation, leading to a variety of clinical manifestations. There are different issues. There's the atrial septal defect, which is like abnormal opening of the intra-atrial septum. There's ventricular septal defect, which is abnormal opening of the intraventricular septum. There's tetralogy of Fallot, a combination of 4 defects, including VSD, pulmonary stenosis, overriding aorta, and right ventricular hypertrophy. There's transposition of the great arteries, hypoplastic left heart syndrome, which would be an underdevelopment of the left side of the heart, including the left ventricle and aorta. So, moving on to physiology. These physiological changes and symptoms can vary widely depending on the specific congenital heart defect, its severity, and the age at which it is diagnosed and treated. Early detection and appropriate management are crucial to improve outcomes and prevent long-term complications. There is abnormal blood flow, which would be an increased or decreased cardiac output, impaired oxygenation, elevated pulmonary pressure, obstruction of blood flow, altered pressure in chambers. Some symptoms would be cyanosis, respiratory symptoms, heart failure, poor weight gain, palpitations and chest pain, fatigue and exercise intolerance, sudden death, edema and ascites, characteristic murmurs, cyanotic episodes, delayed growth and development. Moving on to the diagnosis of congenital heart defects. You have prenatal diagnosis, which is found through an ultrasound or fetal echocardiography. Echocardiography. There's clinical examination, which would be checking for heart murmurs and cyanosis and abnormal vital signs. Chest x-rays helps visualize the size and shape of the heart and the lung fields, and they may reveal signs of heart enlargement, pulmonary congestion, or abnormal vessel positioning. There's electrocardiogram, which records the electrical activity of the heart, and it may show abnormal rhythms or signs of hypertrophy of heart chambers due to chronic defects or overload. There's cardiac MRI, cardiac catheterization, pulse oximetry, genetic testing, which would be checking for different issues that could arise, characteristic murmurs. In cases actually where there's a congenital heart defect is suspected to be part of a syndrome, genetic testing can help identify those. And then when it comes to treatment of congenital heart defects and AI, for treatment you have medical management, which can be used, can use medications, drugs like diuretics, ACE inhibitors, or beta blockers may be prescribed or manage symptoms of heart failure or reduce the workload on the heart. There's oxygen therapy, there's surgical repair, open heart surgery, which is common for repairing defects such as VSDs, ASDs, etc. There's palliative surgery in some cases, which are performed to improve blood flow, or oxygenation in preparation for future corrective surgery. There's complete correction. There's catheter-based interventions, there's heart transplantations, ongoing management is something that comes into play. And in case, that's it. Thank you for taking the time to listen to my presentation. Recording can be kind of rough, and did the best I can, and you were patient in listening. Thank you.